It is a huge honor today. I'm in Singapore with one of the most famous orthodontists in Singapore who lectures around the world. He actually got out of dental school in Singapore in 1976. Then, to become an orthodontist, you went all the way to Pittsburgh,
Yes, that's correct.
which is why I found a Pittsburgh Steelers football fan
Hi.
all the way in Singapore. We are both reminiscing about the glory days of Terry Bradshaw and Lynn Swan.
That's correct.
That was as good as the NFL ever got. I don't think it can ever
Well,
get that good again.
yeah, they won so many Super Bowls. No?
Oh my gosh, that
I
was
think
just,
5 at the time.
yeah, they were an amazing team. You've been doing orthodontics for years and years and years. What's new in orthodontics?
Well, I think orthodontic has moved along very well. The things that I learned from then and now is quite different. For example, uh, the computer has came in the sense that Invisalign is here. All these are computer-guided treatment. Then you have self-ligating brackets, which are moving teeth faster, more comfortable, less pain. And the latest is you have micro osteoperforation in terms of propel that is using little tiny screws that puncture holes in the bone that allow the teeth to move faster. So these are very exciting development in orthodontics.
So you are you using Propel?
Uh, Not at the present moment, but
You're not using it.
but I have been using mini screws. You must remember that the Propel was not sold in Singapore at that time. Propel has just come into Singapore. So when I read the article in AJO, so what I did was I used mini orthodontic implants, the TADs, to screw into the bone and then just remove the TADs and throw it away. So the principle is the same, but of course with Propel it's much safer and easier to do.
So to Propel, it's an interesting surgery, but it would kind of be a strange business model because you could do the micro perforation
That's correct.
with about anything. And you're saying you're using TADs?
Yes, of course.
And
we use
what
TADs.
does TAD stand for?
Temporary anchorage device. These are little screws that we put into the bone for anchor, skeletal anchorage. And across the Americans have very nicely say that we shouldn't call it a screw. It's too traumatic to the patient. They call it temporary anchorage device. It's a nice name for the patient to receive.
So on the self-ligating brackets, what brand do you like, or what are you using?
Uh, as you all know, the pioneer of this was actually from Aramco, the Damon system. So before Damon system was famous, I was given some of the brackets in Singapore. In fact, I was one of the very first few one to use the Damon system in Asia. So I'm stuck with that system. But of course now the a lot of development in new type of self-ligating braces from many other companies.
And why are you a fan of self-ligating? Just because you don't have to have the rubber bands?
First of all, it's easier to use the system. You don't have to ligate the rubber band. You don't have to take it out every time the patient change a wire. Remember the fact that in the practice of dentistry in this part of the world could be very different from US. For example, in Singapore, only the orthodontist can touch the patient, can change the wire. We cannot use auxiliaries. So every minute that we save on, let's say, for example, removing the ligature is very important to us. So time is a factor. So that is one. That means we shorten the visit time. Two, there's less pain because we're using lighter forces. So my patient would tell me that, hey, I have discomfort for 1 or 2 days, but my classmate, they saw they have pain for 2 weeks. So that is a big plus, the pain factor. Three, we can do more non-extraction cases. In fact, I have put my case in Facebook. Not Facebook, sorry, in YouTube. Yeah, that some of these cases that in the past we felt that you have to extract 4 teeth, but it can be done nicely without extraction. So these are the things that really encourage me to use more of these self-ligating brackets.
So what countries have you lectured in?
Oh, I've lectured in 20 countries.
20
Yeah,
countries.
so to name them all could be quite long. Most of the Asia Pacific countries.
Asia Pacific?
Yeah, US, I've been to lecture there too. Now I'm going to
And
Moscow.
you've lectured in Moscow?
I'm going to Moscow in April. Moscow and St. Petersburg. So that's exciting to me. New frontiers.
I love St. Petersburg. That is that is so interesting. But you got to go there the right time of year. You can't go lecture there in January or
Oh
February.
yeah, that's too cold. That's too cold.
It's key to visit St. Petersburg in May, June, or July or August.
Yes, that's a peak period. Yeah.
So, when you talk about using clear retainers like Invisalign,
Okay.
that gets very cost prohibitive in a more poor country,
Oh, yeah.
say Indonesia, than it does in a rich country like Singapore or Japan or Hong Kong.
That is absolutely correct. One of the reasons why this kind of technology is not adopted so quickly in Asia is because of the cost. I mean, I understand that, for example, in India, a case may only cost $500 to complete the case. And we pay about $2,000 for Invisalign. So it is quite prohibitive. But right now, as we all know, that there are many other compatible systems of aligners that's coming out from all over the world. And of course, they are not so popular now because there are a lot of patents that is still being held by Invisalign. But as the patents move away, then I can foresee that more of these regional aligners company will push their products in the market and bring the price down. And in fact, I realized that Invisalign is trying to bring the price down too. Recently, I received an email that said that if we can send 4 cases, maximum of 4 cases within the next few months, they will reduce the price by 25%. So I think Invisalign is receptive that they have to drop the price in this region.
Any companies, any lower cost competitors to Invisalign that you can think of now? Have you heard of Clear Connect out of?
Yeah, Clear Contact, Clear Sure.
What are the other ones? Clear what?
Clear Connect.
Clear Connect.
Is it Sure Clear or Clear Sure? I can't remember that. There's iRock.
Clear Sure and iRock.
iRock, and there are
Huh.
there's many more. You know, Korean company, Middle Eastern companies. There are much more.
I haven't heard of Clear Sure, and I haven't heard of
iRock.
iRock.
Yeah.
But iRock, that's an interesting name. Do they rock?
Well, they perform quite good, I must say.
Yeah.
I've tried iRock and I've tried Invisalign, just two.
Just two.
Yeah.
So tell me, in your practice in Singapore, what % is fixed bracket? What % is Invisalign? Is it different mix for adults versus children?
I think there's no difference between adult and children, but I must say that I'm quite slow in adopting the technology because of the price. I would say maybe 10% of my cases are using the aligners. I should use more because the technology has improved tremendously and they can actually produce quite good results. Of course, case selection is very important. You have to select the right case for aligner treatment because they are not 100% efficient.
So go back to that question. So you're using more fixed bracket?
Yeah, I'm using more fixed bracket, but I would love to move to the aligner system because I think the potential of aligner system is quite good because of the technology improvement. And hopefully the price will come down.
And you see the price coming down with ClearSure and iRock.
I think so.
So what else has got you excited in orthodontics?
Well, other than technology, the usual stuff like patient's appreciation. What I really am excited is that we are doing more and more cases non-extraction. Now the diagnosis is no more based on how crowded your teeth are, but where your lips are. Many other orthodontists too now are lecturing on diagnosis based on the face, not on the teeth. So as long as your teeth are retruded, we can widen your arch, expand your arch a bit to support the lips, even though it is crowded. I mean, I've done cases that's 10 millimeters crowding, non-extraction with self-ligating brackets, and that's not a problem. So as I said, I'll just post one case in YouTube, and I hope that in future I will post more.
I wish you would post it on Ortho Town.
Oh, I would love to.
Or Dental Town. Ortho Town is only for orthodontists. You have to be an orthodontist.
Okay.
But then Dental Town has an ortho section,
Okay.
orthodontist section, and orthodontists post cases there. Yeah. But I wish you would post those
Sure,
cases.
since I met you, I would love to.
Yeah, and what's really neat is so many of these dentists are posting their cases on the app. So we have a Dental Town app, an Ortho Town app,
Okay.
and then a Hygiene Town app for hygienists.
Yes.
But I would love to see those cases sharing
Sure.
those. That'd be
I think it's
fantastic.
important that we share, and I appreciate you're doing all this work in Dental Town, Ortho Town, and Hygiene Town, you call that, and share for free for people all over the world, because there are a lot of people in other part of the world that are not very wealthy. They can't go to States to learn something. They have no money to further their education. I think what you guys are doing is really admirable.
Well, there's nothing more romantic to me than to be in a dental school in Tanzania or Ethiopia or Nepal and watching some 18-year-old little kid learning dentistry on their iPhone on Dental Town, and it just makes me feel like such a proud papa to be able to transfer so much knowledge from the older 40, 50, 60-year-old dentists from around the world to any 19-year-old kid in any dental school on earth.
That is exciting. When we were in dental school, if the teacher doesn't teach us, we don't know.
Right.
They have the privilege to withhold knowledge, and we are in the dark. But now no more. We can Google and learn. That's really exciting.
Think about when we were kids. It took 5 years to write a textbook, and then when the school bought the textbooks, they would use them for 10 years.
Yeah.
So you could be at the best case scenario, it was 5-year-old information.
Correct.
And at the worst case scenario, it could be 10, 15, 20. I mean, I've been in dental schools in Nepal where all the textbooks were at least 20 years old.
Yeah.
But then they switched from a 20-year-old textbook to Dental Town and watched some course that was posted, yesterday.
Wow.
So the internet is a complete
it's
game changer.
That's correct. It's amazing. It's amazing.
Yeah, complete game changer. So what else has got you excited in ortho? You said computer. You said self-ligating. You said technologies like Propel, microabrasion, causing injury to the bone to make the teeth move faster through the bone. What about diagnosing? 3D X-ray machines, computer-aided modeling. Is that a game changer, or are you still mostly using a two-dimensional pantograph and a two-dimensional Ceph?
No, I have a cone beam CT in my office. I think for generally speaking, for diagnostic, for orthodontics, I think the two-dimensional approach is good enough. Unless you have, like, for example, you want to see how much bone the patient has, whether you can widen the arch enough, like, are you going to push the teeth out of the bone, available bone, then the 3D X-ray will be useful. Yeah. So I would say that the 3D X-ray is useful for selective cases. Yeah. Maybe a periodontal case, or case that's very crowded and you see that the mucosa is very thin. You dare not widen it because you're going to push it out of the available bone. So with the cone beam CT, you can see the amount of available bone there. Then you're more confident. So these are not common cases. So routinely, I think what we are using now is still good enough.
And what
Oh, by the way, before I forget, impacted teeth. This is where cone beam CT is very important. Because impacted teeth, you want to see in 3 dimensions. For example, impacted canine. How are we going to check the canine out? Is the canine crown very near the roots of the incisors? So 3D X-ray will be very useful for impacted teeth. That is the exception.
So, when you travel around the world, like in Southeast Asia, you have a different mix of orthodontic cases than, say, if you were in Europe. Japanese, Korean, Singapore, Malaysian, Vietnamese, different mixes of ortho than, say, German.
Correct.
So what are the more typical Asian profile, typical ortho cases that would be different than, say, if you practiced in London?
Okay, that's a very good question. In Singapore, we have a large group of expatriate population. So I still treat a lot of white patients, Caucasian patients. So what is the difference between the Caucasian patient and the Asian patient? That's racial differences. For For example, the lips of the Asians are more protruded, yeah, than the Caucasian. Our incisor angle, yeah, is different from the Caucasian, yeah. So our incisors are more protruded. So the question we ask ourselves, should we treat an Asian face or Caucasian face? If you want to do that, then you have to extract teeth to bring the lips in. But if you don't, then we can maintain our lip or even move it a little bit out. But to the perception of the Caucasian orthodontist, hey, this is too bimaxillary protruded. But it's not true. There's a racial characteristic. So the biggest change, I would think, or difference between the Caucasian and the Asian would be the lip profile. We can accept more lip protrusion. That's our norms.
So you're saying Caucasians accept less lip protrusion
That's correct.
than Asians?
Yeah. Then of course you have the third category, which is the blacks. Yeah, the blacks even more protruded. Yeah, you see in America, you look at the Caucasian lips and the lips of the American African American, the lips are completely different. So we are right at the center between the Caucasian and the blacks.
I think it's so funny how Caucasians are trying to use Botox and dermal fillers to push their lips out, and then a lot of Asians are trying to pull their lip back, and it's kind of funny because all these women are beautiful whether they do anything or not. I just think it's funny how they think they have to do this.
That's why I said my personal opinion is that we try to extract teeth because as you grow older, the lips will shrink. So if you extract 4 teeth, it looks nice at the age of 15. By the time you reach 55, the lips are a bit collapsed. Then you can start using fillers. So if I don't extract teeth, I position my teeth slightly forward at the age of 15. Then by the time you're 50, they just look nice, beautiful.
So when you got out of ortho school in Pittsburgh, Steeler Country in 1982, did you come right back to Singapore?
Yes, I have to come back because I was a scholarship holder. I have to come back to teach at the University of Singapore.
And from when you came back in 82, was orthodontics mostly children, and now in 2016 it's more half children, half adults, or how was the patient mix change from 82 to 2016?
This is a very interesting question because most of our orthodontists at that time were trained in England. So I was the first orthodontist that's trained in the States for a 3 years program, the first one. So I admitted to school in 1979. So when I came back, fixed appliance is still not very common, you know. So you're still using the removal appliance with the wire spring to move teeth. So of course now, because of the knowledge that spread across the world so rapidly, fixed appliances is everybody using fixed appliances. We throw away the removal appliances with finger spring. In terms of patients, whether they're children or adults, obviously there are more adults having braces now because they're more aware of it. And of course, there are more education they receive. They go to the internet, they see that, hey, I'm 45, I still can make my teeth straight. So there's no question to me that the perception of adults wearing braces is no more a taboo. They accept it very well.
What about tooth whitening from 82? I remember back in the 80s, a lot of people around the world thought American teeth were too white. Are you seeing more tooth whitening, more bleaching in
Oh, definitely
Asia?
so. Definitely so. Somehow the whiter the tooth is, it's perceived as the person being more attractive and more young. So yes, there are much more requests for tooth whitening, even from children. You'd be surprised we have patients who finish their treatment at 15, they want tooth whitening. Yeah, and as you know now, tooth whitening is so common. There's so many type of material available for whitening teeth. So it is very commonly requested for now and delivered, of course, the treatment.
So now, do orthodontists in Singapore, do they provide cleanings with hygienists, or is that something they do not do and the general dentist does that?
It depends on the setup of the clinic. Clinic that set up purely restricted to orthodontics, then they will not provide cleaning. Yeah, they don't even provide hygienists. But there are many other clinics which is multi-specialist practice or practice with general practitioners. Then in-house, they will provide cleaning and whitening.
So how many orthodontists are in Singapore?
Well, the last count, we have about 120 20 plus.
120 plus
Yeah.
for 5.5 million people.
Yes.
So is that enough, or do you think there should be more, or is it too many? What is the supply and demand like for an orthodontist in Singapore?
Before I answer about the supply and of orthodontists to the population, we also must recognize that there are also many general practitioners doing orthodontics, like many other countries. So just by looking at the number of orthodontists and the population and talk about the supply and demand, it may not be accurate, because there may be another 500 general practitioners doing orthodontics. So right at the moment, the unique thing about Singapore is that the government provides subsidized orthodontic treatment to all Singaporeans, irrespective of their income.
And why is that? Why do they do that?
Because the government felt that they have a role to do that. They provide free dental treatment for all children in school. Their dental clinic in school, they all receive free dental treatment, by the way.
In dental school?
In their school, yeah.
Uh-huh.
And you have to opt out if you do not want the service. And from the school, if the dentist see a malocclusion, they send it to the National Dental Center, and they will provide them subsidized orthodontic treatment. So that's very unique in Singapore. So is there enough cases to go around? Well, I can also tell you that most of the children are done in the government clinic. So we are training more adults.
Oh, so when a child gets free dental or free ortho, it's at a
Also, it's
government.
subsidized, not free.
Okay, it's subsidized, but it's at a government clinic.
Yeah,
Okay, so you have government clinics and private clinics.
correct.
Yeah. And do you have many friends that work in the government clinics?
Of course we have.
And do they like working there?
Oh, some of them like it's just like any other thing. Some of them like to work there. Some they don't. Some of them are trained there. They have a bond to work there for a few years before they can go to private practice.
So what are your hours at your dental office?
Well, I work from 9 to 6,
How many days a week?
5 days a week.
5 days a week, 9 to 6.
But most of us work 5.5 days a week.
5.5 days a week. Yeah. Is it fair to say that Asian dentists in general work more hours than
course.
European dentists?
Oh yeah, some of them open at night too.
Yeah.
Yeah, I have seen dentists who open 9 to 9, Monday to Friday. Saturday is 9 to 1, and Sunday is 9 to 1.
I
We work
know.
7 days a week.
I know. I've lectured around the world, and United States, Canada, Australian, England, France, Italy. They work few hours, and then you go to Asia, and I mean they almost work twice as many hours.
Maybe, yeah. I'm just thinking a lot. Maybe it's a tax structure.
The tax structure.
Yeah.
I think it's just the cultural work ethic.
Yeah. You see, like for example, I know people in Australia because the tax structure is so high. They say, why should I work so hard? When I cross a certain amount of income level, all the money goes to the government, so they don't have to work so hard. Maybe I don't know. I'm just guessing.
Yeah, tax policy can
Yeah.
do something, but I just think it's my feeling that Asia just has a much harder work ethic.
That's correct. That's correct. They work harder.
They just and a lot of them just it's their identity. I mean, a lot of Asian people I know, no matter what field they're in, they just love to work. Their life is their work. They live above their shop.
Yeah.
They
They live in a house.
Yeah.
They open the clinics in the garage.
Yeah.
In Indonesia, it's like that.
Yeah, I mean, I see that they live in their office, and if someone wants to see a dentist at 9 o'clock on a Sunday night, they're right there. They're ready to
Or
see
some
him.
of them even work until 11 at night.
Yeah,
Yeah.
yeah, I know. I've been sitting like at a restaurant. I'll see a dental office, and it's like it's their office, it's their house, it's
Yeah.
their family, and you could get a root canal at exactly 11 o'clock at night. What else has got you excited in orthodontics? Or let me go this. What all have you seen change since 1982? What else have you seen from 82 to 2016? That's a long time.
Well, I've mentioned again. I just recall what I've said. Self-ligating. Mini implant is exciting. And the night-tie wires. At my time, there's not so much of night-tie wires. They're very exciting. Thermal activated night-tie wires. Then of course you have Invisalign. Now you have Propel. I think the next one will be perhaps more and more clinic will own a scanner, intraoral scanner, because that's the way to go, you know. Because the new generation dentists are all very knowledgeable in technology. So whether they cut a cavity or they want to do a study model, the scanner comes to play. And why is the scanner not taking up as quick as it should be, the intraoral scanners? Because of cost. If the cost comes down, then everybody will buy a scanner. So I'm waiting for the cost to come down, then I would buy a scanner too.
And what scanner do you like? What are you looking at?
Well, I was looking at the studies in the internet. They have iTero, they have I think this one from Aramco, this one from Plamica, this one from Siemens, this one from Connaught or something like that. There's so many. They're tree shaped. So I'm very confused as to which one to buy at the present moment.
And what would you be doing with this scanner?
Oh, we can study model. We don't have to take impression anymore. We can use retainers on that. We can mix a liner. Yeah. For a general dentist, of course, you can do crown and bridge. So there are a lot of use for intraoral scanner. I think the future is going to be an intraoral scanner future. In fact, Singapore, every year there's one CAD/CAM conference in Singapore. Yeah, in November, December. It has been going for the past 2 or 3 years. So it's very exciting to see the development.
It's no doubt the whole dental industry is going digital. It's going from analog to digital. So from impressions to oral scanning. But it's just going to come down to at what price does it make sense?
And how fast. Because how fast and how accurate. From what I get, the accuracy is quite okay. They've done all the study of the accuracy. They are quite good. But now how fast? Because you don't want to spend half an hour scanning a upper and lower arch, you know. If you can do it in 5 minutes or 10 minutes or 7 minutes, that's okay.
And it also depends on what your costs are. Like if you're in a poor country, so the price is low and your labor is low, then it doesn't make sense. You know, but if you're in a country where labor is very expensive and your own labor is very expensive, then it starts to make sense.
I had an interesting conversation with Dr. Wayne Hickory yesterday. Do you know that our Singapore government actually subsidize equipment that we buy?
They subsidize what?
Equipment that we buy. For example, you buy equipment for 100,000. They can subsidize up to 60%.
Mm-hmm.
The government give you money to buy, as long as it increases the productivity of your office. So I think there's the only government in the world that give money to the profession to upgrade, you know.
Well, Singapore, you know, I studied business. I have a master's in business from Arizona State University, and Singapore is still considered the #1 economic miracle of all time. I mean, no other society went from poor to rich that fast, ever. And everybody studies Singapore, and it was truly so. Everybody should study their tax model, their investment model. I mean, it was just amazing. I mean, you've lived through a lot of this. What year did Singapore get its independence from? 1964?
I think 65.
65. And when were you born?
52.
So in 65, you were 13 years old. Mm-hmm. So you lived through it. You remember this?
Yeah, of course. I remember Singapore was quite poor.
You remember when it was poor?
Of course.
And when did it start going from poor to rich?
Wow, maybe in the 70s.
Why do you think Singapore went from poor to rich so fast, whereas other countries around it, whether it be Malaysia or Thailand or Cambodia or Indonesia, did not, grow the economy that fast? What do you think was the Singapore miracle?
I think it all boils down to our late previous Prime Minister Lee Kuan Yew, because he has a vision, and he's told everybody that, look here, nobody owns you a living, nobody owns Singapore a living. We have to work hard for ourselves. We have to do things for ourselves. Don't depend on other people. So from there, I think one of the most important thing, he selected the brains to run the country. Yeah, he wanted the country to be run by very smart people, number one. Number two, zero corruption, zero tolerance to corruption. If you are corrupted, you'll be caught, you'll be you get what you deserved. Yeah. So there's literally no corruption, and education. A lot of money spent on education. You will look at the libraries of Singapore. Just to go to a library, it's amazing the amount of resources that a child can receive. So now we have a generation of people whose education level goes up. Okay, and everyone receive free education. I think primary and secondary school. From there, they select all these people, and of course, they give scholarship to the better ones, and from there, they groom them up to be leaders. So now Singapore has good leaders across the board, whether it is in the government or in the statutory board or in schools, anywhere. So the brains start to work. When the brains start to work, they also understand one thing: you cannot be corrupted. Yeah, you cannot be corrupted. You work for the company, you work for the country, and this is how the whole country move up.
You know, and that's one thing that people don't talk enough about on economic policy. But when you talk to people who have a doctorate in economics, not dentistry, corruption is a huge factor. And when you go to areas, it reminds me of a joke. Can I tell a joke? This might be a bit too racial, but a businessman shows a bridge to a reporter in America, and he says, "See that bridge? I got the government contract. I got 10% of the deal." And then the next week they're in China, and the businessman tells the journalist, "See that bridge there? I got 20% of that deal." And then they go to Africa, and the guy says, "See that bridge there?" The guy says, "I don't see a bridge." He goes, "I know, I got 100% of the deal." And when you study corruption, the United States is ranks high on the corruption level. When you look at corruption high in Mexico or Brazil or United States, it really does hurt the economy. Yeah. And so compare the lack of corruption in Singapore to like neighboring states, and how do you think that played into the economic expansion?
Okay. One thing that is interesting to note is that our ministers are paid very highly. In fact, our prime minister is paid much, much higher than Obama, you know.
4 times as much.
Yeah,
$1 million a year.
Yeah, yeah.
And Obama's 200,000.
Yeah. So if you want people not to be corrupted, they must be full first. They must be hungry. Yeah. So if you are hungry as a leader, you will start to take in something that you're not supposed to take in. And in fact, we have mentioned that if they take in those money they're not supposed to take in, it costs you more than $1 million. You may take in $10 million instead of one, you know. So the first thing the government did was to pay the leaders well. And this, of course, has a political price. Because people will say, "Hey, how can you make so much money? You're a minister, you're supposed to serve me." But look at the progress of Singapore. Okay, once you get rid of the corruption, now the people above has a clear mind to work. You know, they don't have to worry about, is somebody investigating me? Am I taking too much? So they just focus on their work. And of course, we have leadership to controls it's like a pyramid, isn't it? The top control downwards. So when they control all the leaders well, then the leader will also control the third layer, fourth layer, fifth layer well. So the country progress. And don't forget also, you must have smart people running the country. Yeah. And people say, "Why must you be smart?" I can have the smart people may not understand what the poor people feels. What the poor feels. Like for example, I was told that in some country, the government give land to very rich people. So I give you this land for certain years, or sell it to you at a certain price. You build a shopping complex. So the poorer people say, "Why are you so biased? Why you give it to us? Just because you're rich, you give it to him." But if the government give the poor people, have no resources to develop the place. So in a way, the rich get richer, but the rich now employ the poor or the middle class. So I was always said that how can you have so many rich people, but don't forget, as long as the rich people share their wealth, that's good enough.
Do you think having English as the official language was a big factor too?
Tremendously. Because you can see that some countries, they are very chauvinistic. They say, "No, we don't want to learn English because we want to have our own language," which is fine. And there's nothing wrong with that. But in Singapore, because of our multiracial component, we have to be very careful not to upset racial differences. They may cause racial discrimination and racial problems. So in order to choose a language that all the races will accept, Lee Kuan Yew chose English. Because if we choose Chinese, then the Malay will say, why not Malay? If we choose Malay, the Indian will say, why not Indian? So he was very smart to choose English. That actually harmonizes the whole country. That's number one. You must have religious and racial harmony for the country to grow. Yeah, you know that there are countries that have so much problem between race and religion. It can't grow. Yeah. So when that is done, English became our main language. But we did not neglect the mother tongue. Everyone in school must do their mother tongue, whether you're Malay, Indian, or Chinese. So now you preserve your own culture, so you get the best of both. With English now, the Singaporean can go all over the world. But Lee Kuan Yew also had a vision. China is going to grow. Before China grew, so he emphasized a lot on Chinese. So now a lot of our people are bilingual, good bilingual, English and Chinese. Even the Malays and Indians are learning Chinese. So when we go to China to do business now, it's no problem. So that is foresight.
Yeah, it is amazing how you can go to so many countries around the world, and if you know English, you can get by fine. It really has become the international language, isn't it?
Correct. That's correct.
And the countries that really adopt it seem to be doing so much better than when you go to a country and no one really speaks English.
Yeah, like Philippines, for example, they export all the workers overseas. A Filipino can work anywhere because they learn English. You can export an Indonesian overseas; they can't communicate.
Indonesians
Because
have a hard time with English.
Yeah, I mean, because Indonesians only speak in Indonesia.
And Japan is very hard to find any English.
The young people are learning English. The young people are better now.
But when I'm talking to dentists there, I mean, the majority of them can't speak English to me.
They can read.
Yeah, they can read it.
They can
can't
read,
speak it.
because they don't practice.
Yeah, you use it or lose it.
They can read.
Well, is there anything else you want to talk about?
Well, we're happy to have you here in Singapore. I'm fortunate to have an interview podcast with you. I was given a notice yesterday. I grabbed it, of course, knowing Howard is here. I wish you all the best, and please continue to help people in the world. Give your free education. I'm sure there are many people all over the world, especially the less developed countries, will really, really appreciate the work you're doing for dentistry.
Well, thanks. It's a labor of love.
That's great. That's great.
All right. Well, thank you so much for
Thank
your
you
time.
very much. Thank
Okay.
you.
Bye-bye.